Okay, so this is the second video for chapter 18, and we are going to start by looking at individual glands and organs that secrete hormones. So they are part of the endocrine system, and we're going to start by looking at the thyroid. So the thyroid gland is in your neck. It sits just below that Adam's apple, that hard cartilage that you feel in your neck. And the thyroid gland contains two different types of cells that secrete hormones. It contains the follicle cells and it contains the C cells. Each of them secrete something different. So the follicle cells secrete what we call the thyroid hormones. There's two different types of hormones. There's T3 and T4. T4 is called thyroxine. And both of those kind of act together to increase metabolism in all of your nucleated cells. So actually all cells that have mitochondria, I should say. So when your cells, one of the organelles that they have are mitochondria, then T3 and T4 can bind to those cells and it'll increase the rate of ATP production from those mitochondria. So what we can say is that T3 and T4 increase metabolism. So I don't really like this increases metabolism of all nucleated cells. I would say pretty much of all cells because most cells have a mitochondria. So it increases metabolism of all cells. It makes those cells create more ATP. So we know a person that has hyperthyroidism, right? They actually are putting out more T3 and T4 than they should, so they will end up having more ATP production than they should. That ATP production is going to make them jittery. They're going to be hyper, have a lot of energy. They'll be thinner because their cells are constantly tearing down and using glucose in order to make ATP. On the other hand, a person that's hypothyroid, they don't make enough T3 and T4, so they're going to feel fatigued and sluggish because they're not making enough ATP. They're probably going to be overweight or have more weight on them. So that's what the thyroid hormones do. They increase ATP production by stimulating the mitochondria of all cells. Then we have the C cells, and the C cells are going to secrete a hormone called calcitonin. Calcitonin decreases blood calcium levels. I like to think of calcitonin as there's two N's in there, N for negative, so it has a negative effect on blood calcium. It decreases the blood calcium. It takes calcium out of the blood. So what happens to it? How does it take calcium out of the blood? Well, it'll be excreted by the kidneys, so it'll end up in your urine, right? So that's one way that it can get rid of the calcium. It will stimulate osteoblasts because osteoblasts make new bone, and then we can take the calcium out of the blood and put it in the new bone. So those are just some ways. It'll also prevent absorption of calcium from your diet. Okay, so that's what calcitonin does. It has a negative effect on your calcium levels, so it decreases, in other words, it decreases your blood calcium levels. Now, right behind that thyroid is, you'll see on the back side, this is the posterior side of the thyroid, there are these 4 pea-sized glands that are called the parathyroid glands. And the parathyroid glands release a hormone called parathyroid hormone. So parathyroid hormone does the exact opposite of calcitonin. It increases blood calcium levels. So how does it do that? It does that by stimulating osteoclasts. So the osteoclasts tear down bone, and when they tear down the bone, they release calcium. What else do? They prevent excretion by the kidney. And they also stimulate calcitriol production. And what does calcitriol do? Calcitriol increases absorption of dietary calcium. So basically, PTH increases blood calcium, whereas calcitonin then decreases blood calcium. All right, the next gland that we're going to look at is called the adrenal gland. And the adrenal gland has an outside and it has an inside. The outside we call the cortex, the outer layer we call the cortex, and the inner layer we call the medulla. Now we already know what the medulla does. The medulla secretes norepinephrine and epinephrine, right? It does this through sympathetic control. So when a preganglionic sympathetic neuron stimulates that medulla, it causes the medulla then to release norepinephrine and epinephrine, and that causes sympathetic activation. Well, what does that mean? What norepinephrine and epinephrine are really doing is they're trying to release storage of nutrients so that all the cells in your body can use those nutrients to run away from something, fight or flight, right? So, for example, we have the skeletal muscles. Skeletal muscles store glucose in the form of glycogen. So the skeletal muscles will release glucose. Basically, they break down glycogen into glucose. In the adipose tissue, the triglycerides will be broken down to release fatty acids. The liver is another organ that stores glycogen. So glycogen will be broken down and glucose will be released. And then norepinephrine and epinephrine also affect the heart and will increase the heart rate and increase the force of contractions. Well, we've already talked about the adrenal medulla in the sympathetic nervous system. So that shouldn't be too hard for you to go back and review. What we didn't talk about, though, was the adrenal cortex. Now, the adrenal cortex has 3 layers in it, and we're not going to go over the specific layers, but each layer is going to secrete a different group of hormones. We're going to talk about those different groups of hormones. One group will release the hormones that are called glucocorticoids. So glucocorticoids, the main glucocorticoid is called cortisol. So cortisol, you've heard of cortisol, right? It's like cortisone. So you put cortisone on your mosquito bites. And what happens to the mosquito bites then? They flatten out, right? Well, that's taking away the inflammation. So one thing we say about glucocorticoids is that they are anti-inflammatory. They take away inflammation. But the other thing they do, in the name it says glucose, so we know that they are going to affect glucose levels. They increase blood glucose levels. That's what they do. So they basically they prevent your cells from absorbing glucose. And since your cells can't absorb glucose, it makes the glucose hang out in the blood. So now they increase blood glucose. They do that because they think that, well, if your body is being stressed by some type of infection or some type of physical or emotional stress, it believes that you need to put the blood glucose out into the blood so that your brain can use the blood glucose whenever it needs it. Because you see, your brain can only use glucose. So the glucocorticoids just make sure that that blood glucose is available at all times and isn't being taken into your body cells. One of the things we know with patients that we have to be careful of, if a patient is a diabetic and they're given a glucocorticoid, we have to be careful because glucocorticoids, we know, increase blood glucose. So a patient might be given a glucocorticoid like cortisone or cortisol because it's an anti-inflammatory. It has an anti-inflammatory effect. But if they're diabetic, It might also increase their blood glucose levels. So we have to be very, very careful with that. The next type of hormone group that's released from the cortex is called the mineralocorticoids, right? Mineralocorticoids. The main mineralocorticoid is aldosterone. So aldosterone is similar to ADH. It ends up having the same net effect. It just does it in a different way. Mineralocorticoids, such as aldosterone, increase sodium retention. So they cause the kidneys to reabsorb sodium. Aldosterone helps you to retain sodium and keep sodium in your body so you don't urinate it out. And because sodium is being reabsorbed in the kidney, then water will follow, so water will also be retained. So in the end, aldosterone and ADH both increase water retention, but different mechanisms. ADH just reabsorbs water, whereas aldosterone reabsorbs sodium and then water follows it. You will be hearing about ADH and aldosterone for the rest of your A&P and nursing or healthcare career. So it's really a good idea to memorize exactly what ADH and aldosterone do. ADH causes the reabsorption of water, aldosterone causes the reabsorption of sodium, and water follows it. The last layer of the adrenal gland will release a group of hormones called androgens, and the main androgen is testosterone. So testosterone is, of course, both males and females have an adrenal gland with an adrenal cortex, so females do have a small amount of testosterone being released. Now, in men, we typically don't see anything with this testosterone that's being released from the adrenal cortex because they have the testes, which release a lot more testosterone than what the adrenal cortex does. But in females, this can become much more noticeable. So testosterone from the adrenal cortex in female might actually increase male secondary sex characteristics in a female. So for example, hair on the face, or larger, more defined muscles, or hair on the chest. Again, we don't notice this so much in the males, but we do notice it in the females because the females typically have a very small level of testosterone. So when we look at the adrenal gland as a whole, this adrenal gland is our stress gland. So first, what's going to happen is the medulla is going to kick in and it's going to release norepinephrine and epinephrine. And then if the stress seems to last longer, then the cortex kicks in and glucocorticoids and mineralocorticoids and androgens are all going to be released after that. We'll talk a little bit later about the stress syndrome, otherwise known as the general adaptation syndrome, which occurs when a person is undergoing a lot of stress. All right, let's move on to the next organ then. The next organ that we're going to talk about is the kidney. Now, I drew it this way because the adrenal glands actually sit right on top of the kidneys. So I have a kidney down here, and then up above it is the adrenal gland. Right? So we end up with the adrenal gland on top of each of the kidneys. You have two adrenal glands, you have two kidneys. So the kidney is a secondary endocrine organ. Its main job is not to secrete hormones. Its main job is to filter blood. And so blood flows into the kidneys, and then the kidneys will filter that blood and get rid of any waste products, get rid of any excess water, get rid of any excess hydrogen ions, and then it keeps the good stuff in the blood, like the red blood cells, the white blood cells, the platelets, the plasma proteins, and all of that is going to stay inside the blood, as well as the glucose and the amino acids and all the nutrients and ions and anything good that the body needs to keep, the kidneys will allow the body to keep. But the kidney also, like I said, acts as an endocrine organ. It's its secondary job. So there are 3 hormones that the kidney will secrete. It secretes calcitriol, erythropoietin, and renin. Okay, now, first of all, let's talk about calcitriol. Calcitriol will only be released from the kidney if PTH is released from the parathyroid gland. So when PTH is released from the parathyroid gland, it causes calcitriol to be released and activated from the kidney. Calcitriol then increases calcium and phosphate absorption in the gut, right? So that's what it does. It increases calcium and phosphate absorption. So calcitriol increases calcium in the blood, right? Then we have another one that's erythropoietin. So erythro means red blood cell. Poietin means the production of. So if the blood coming into the kidney has decreasing volume, so there's decreased renal blood flow because there's decreased volume of blood, and if there's decreased oxygen, it will trigger the kidney to release erythropoietin. Erythropoietin targets the red bone marrow, so it will go in the blood and go to the red bone marrow, and at the red bone marrow, it will increase red blood cell production and create more red blood cells. Well, more red blood cells means more blood, and more red blood cells means more oxygen since the red blood cells carry the oxygen. All right, then another hormone that's released under the same conditions if you have decreased blood flow and decreased oxygen, then renin gets released. So renin is threefold in what it does. It will increase your thirst. So renin travels, it gets in the blood and it travels to the hypothalamus and it hits that thirst center in the hypothalamus and tells the hypothalamus that your blood volume is down. So the hypothalamus will make you thirsty. It will increase your thirst. Renin also will increase ADH. So again, antidiuretic hormone is in the posterior pituitary, so renin will also travel to the posterior lobe of the pituitary, and it will cause the posterior lobe of the pituitary to release ADH. And then finally, renin travels all the way to the adrenal cortex, and it'll cause the adrenal cortex to release aldosterone. So it travels to the adrenal cortex and causes aldosterone to be released. And what does aldosterone do? Aldosterone increases sodium and water retention at the kidneys. Right? So those are the three hormones that are released from the kidney and the effects that they cause on the body. All right, so now let's look at a couple of other glands. First, let's take a look at the pineal gland. This is something we've talked about before. The pineal gland is in the epithalamus. The pineal gland causes the release of melatonin. Melatonin then will affect your day-night cycle, so it tells you when to go to sleep and when to wake up. So when melatonin levels get high, you get sleepy. When melatonin levels go away then and they get excreted out of the body, then you start to wake up. We call that the circadian rhythm, that day-night cycle. Melatonin also has some secondary reproductive type of functions, like it slows your the sperm maturation in male. It times the sexual maturation, like when are you going to go through puberty, and it also acts as an antioxidant. So those are just some things that melatonin does. Then we look at the intestines and the pancreas. So here we have the duodenum. This is the first part of the small intestine right here. So these are the intestines, and so from your stomach, we have this content of food and enzymes and hydrochloric acid come into the small intestine. Then the small intestine has these cells. It's lined by cells that are called enteroendocrine cells. Enteroendocrine cells. And these enteroendocrine cells are going to release hormones that coordinate the digestive system process. So for the intestines, I want you to know enteroendocrine cells and that they release hormones to control and coordinate the digestive system processes. But I'm not going to go into all those hormones because we'll save that for another day. Now, tucked right into the curve of the first part of the small intestine, which we call the duodenum, we see an organ that's called the pancreas. So here's the pancreas. So the pancreas has this big duct, and the duct opens up into the intestine, right? So it opens up into the intestine, so anything the pancreas makes can get released into the intestine. So as far as the endocrine function of the pancreas goes, the endocrine function's only about 1% of this gland. The rest of this function of this gland will be in digestion. So again, that's going to be for a different day because those aren't really hormones. Those are more endocrine. Those are more enzymes. But 1% of the pancreas's job is hormones. And then 99% of it are enzymes. So it's making a lot more enzymes for digestion than it is hormones. But we're here to talk about the hormones. So there's two different hormones that are produced by two different cells. We have insulin, and insulin is secreted by beta cells. So there's these beta cells in the pancreas that release insulin. And what insulin does is it lowers blood glucose. So I kind of talked about this in the first video, but let me show you. Here's a body cell here, and then here's a receptor. There's a gate. There's kind of an ion gate there. And on that ion gate, we have a little receptor. That receptor is a receptor for insulin. So the pancreas releases insulin, right? There's the insulin. And so the insulin's released. The insulin's going to bind to that receptor, and then it opens the gate. So now the gate opens, and now we have something can go through that gate. And what's going to go through that gate is glucose. So when insulin binds to the cell, glucose can come into the cell, and now the cell can use glucose, it can store glucose, it can create ATP with that glucose. So insulin is good. We need to get insulin out of the blood, which is where the glucose is. Glucose is in the blood, right? So we want to get it out of the blood, and we want to put it into the cells. But in order to do that, we need insulin. Okay, so now we have another hormone that is released by the pancreas, and it's called glucagon. And so there's these alpha cells in the pancreas that release glucagon. Glucagon does the exact opposite. It increases blood glucose levels. So how does it do that? Well, it stimulates the breakdown of glycogen. So when glucose enters into the cell, glucose is going to, say a glucose molecule, it looks kind of like this. So the glucose molecule will bind with other glucose molecules to become a long chain of glucose molecules, and that is called glycogen. And what glucagon does is it breaks these glycogen molecules apart, so we end up having just regular glucose molecules, and then those regular glucose molecules will go back into the blood. And so now it'll increase, glucagon increases blood glucose levels. Now we find a lot of this glycogen in two different types of cells. We find it in skeletal muscle, and we also find it in liver cells, right? So that's mostly where that is occurring. The other thing, though, is that glucagon will cause other nutrients to break down. It'll cause triglycerides to break down. And when triglycerides break down, they break down into fatty acids, right? And the other thing, so first of all, we break down glycogen in skeletal muscle and liver. Second of all, we break down triglycerides into fatty acids. And the third thing that glucagon does is that it makes new glucose in the liver. So the liver cells, the hepatocytes, they have the ability to take a non-carbohydrate and turn it into a new glucose molecule. And this process we call gluco for glucose, neo for new, genesis for the production of. So that's the third thing that glucagon will do. First, it causes skeletal muscles in the liver to release glucose from glycogen. It causes fat cells to break down triglycerides into fatty acids. And number 3, it makes new glucose in the liver using non-carbohydrates in the process called gluconeogenesis. So you've probably heard of this disease that's called diabetes mellitus or diabetes mellitus. There's 2 different types, but what diabetes mellitus does is that it causes glucose to accumulate in the blood. So in other words, it causes high blood glucose levels. High blood glucose levels is not good because it damages the retina of your eye. It causes early heart attacks. It damages your peripheral nerves. It destroys and damages your kidney. And it damages peripheral tissues to the point where sometimes people have to have their hands and their feet amputated if the diabetes is uncontrolled for too long. So let's look at the 2 different types that there is. So first of all, we have type 1. So type 1 diabetes mellitus is when the pancreas is not producing enough insulin. So we have inadequate insulin production. The pancreas is not producing insulin the way that it should. So a patient then will require exogenous insulin. They'll have to get a shot of insulin because otherwise their blood glucose levels will be way too high, and their cells will never get to that glucose in order to make ATP and make all the processes run inside the cells. Only 5% of diabetic patients have this type. Usually what we see is that this type 1 will appear in adolescents. A lot of times it appears in boys. The second type of diabetes mellitus is called type 2 diabetes. And this is where their pancreas is producing insulin, but it's that the tissues that the insulin is trying to bind to, they don't respond very well to the insulin. So if the cells aren't responding to insulin, here's your cells, there's your gates, here's your insulin, and the cells are saying, no, we're not going to let you bind. We're not going to respond, right? So now glucose, which is hanging out here, which wants to go into the cell, is not going to be able to go into the cell because the insulin can't bind. Well, if glucose doesn't go into the cell, then what happens is glucose will be converted to fats, and then fats can be moved into adipose cells, right? And then adipose cells grow bigger. So normally with people in type 2 diabetes, we associate that with obesity because the glucose isn't going into the cells, it's being converted to fats, and then fats are being stored in adipose tissue. Well, the treatment for this is not to give them insulin. The treatment for this is going to be to have them exercise and to change their diet, to lower the amount of glucose that is being brought into the body. Because the reason we feel that these receptors are not sensitive to the insulin, the reason they don't want to bind to the insulin is because there's already too much glucose and they have been bombarded with insulin. time after time after time after time after time after time with this diet of high glucose, high carbohydrates, finally the cells say, enough. They don't want to bind to that insulin anymore. Okay, so next we're going to talk about a couple of organs, the thymus and the heart. And so the thymus is a gland that sits right above the heart. The thymus releases a hormone that's called thymosin. Thymosin promotes lymphocyte development and maturation. So it doesn't cause lymphocyte production to increase, but once lymphocytes are produced, it stimulates their development, so they develop faster, and it stimulates how their maturation makes that faster too. Now, right below the thymus is the heart. So the heart is a pump, and it pumps blood through your body. So blood comes into the right side of the heart, and then it goes to the lungs, and then it comes back to the left side of the heart, and then the left side of the heart will pump out that blood to the rest of your body, right? So the heart functions the best when it has the optimal amount of blood, because if you have too much pressure from blood against the walls of the heart, it just doesn't pump as well. So what happens is that if too much blood is coming into the right atrium, for example, if you have high blood pressure, and so high blood pressure can be from too much volume of blood, and so that high blood pressure, all that blood is coming into that right atrium. The right atrium then has cells in there that will release a hormone called ANP. And in the ventricle, there are cells in the ventricle that will release a hormone called BNP. Together, ANP and BNP are called natriuretic peptides. So these natriuretic peptides are going to be released whenever the blood pressure is high. ANP is called natriuretic peptide because it's coming from the atrium. BNP stands for brain natriuretic peptide. It doesn't come from the brain, though. It comes from the ventricle. So when these natriuretic peptides are released, they will travel to the kidney and they will promote sodium and water from being lost at the kidney, meaning you will urinate out sodium and you'll urinate out water. So as you're urinating out water, then the blood pressure, your blood volume goes down, and blood is part of your volume of fluids. So then your blood pressure will decrease. So that's the goal, right? When you lose water, that will lead to decreased blood pressure. The other thing that these hormones do is they inhibit ADH and aldosterone. So these natriuretic peptides oppose ADH and aldosterone. And what did we say ADH and aldosterone did? ADH increases water retention. Aldosterone increases sodium retention. So if these natriuretic peptides oppose these, they stop water retention, they stop sodium retention, so you are not reabsorbing water, so instead water is going out into the urine, and that's going to lower your blood volume. So it'll lower your blood pressure. All right, let's look at the gonads. Okay. So we're going to look at the male, and then we're going to look at the female. So in the male, these are the testes for the male. And of course, I have to mention FSH and LH. They come from the anterior pituitary. They're the ones that are going to start this. So when FSH and LH target the testes and they bind to the cells in the testes, then the testes will release a hormone called testosterone. Testosterone causes sexual behaviors in men. It causes sperm production, and it causes secondary sex characteristics like hair on the face, hair on the chest, hair under the armpits, hair in the genital areas, increased muscle mass, a lower voice, all the things that we kind of associate with the male. In the female, again, we're going to also look at FSH and LH. FSH and LH target these organs called the ovaries. So when FSH and LH bind to the ovaries, they cause the ovaries to release estrogen. Estrogen causes follicles to mature. When follicles mature, that means the eggs are maturing. So the eggs are being produced and they mature. Estrogen causes these secondary sex characteristics in females. So females have hair under their armpits, hair in their genital area. They have the estrogen causes softer skin, softer hair. It causes breast development. It causes fat to be distributed in certain areas, like in the breasts and the hips. So all of the secondary sex characteristics of females, as well as sexual behaviors of females. Then another hormone that's released from the ovaries is called progesterone. Now, progesterone prepares the uterus for pregnancy. So it makes the lining of the uterus nice and thick so that if an egg were to be fertilized, it has a nice soft landing where it can implant to produce the new baby. Progesterone also prepares the mammary glands for breastfeeding. So it helps those mammary glands to start developing those mammary glands, which will eventually be producing milk for breastfeeding. Okay, then I want to look at fat cells. So over here, these are adipose cells. You can always tell what adipose cells look like because they look like a class ring. There's a dark nucleus that's shoved over to the side of the cells, and then there's a big ring on the inside of triglycerides that take up pretty much the entire rest of the cell, and it just makes it look kind of like a class ring, right? So inside that cell, we have lipids in there. There might be some glucose too. Those are things, extra lipids and extra glucose that got converted to lipids that just get stored inside those adipose cells. Now, those adipose cells can release a hormone that's called leptin. So when these cells get nice and full, because this glucose and the lipids from your diet are brought in and are being stored, they will release, the cells release leptin. Leptin travels into the blood and it goes to the hypothalamus, and the hypothalamus then binds to the leptin and you feel a sense of fullness, which we call satiation. You now feel satiated and full and no longer hungry. And so this will suppress your appetite because your cells are saying, I'm full. I don't need any more storage. Okay? All right, so that's it for all the hormones. Now, there's a couple of things I want to regroup together and go over. I want to go over hormones that are involved in growth, and then I want to go over the hormonal response to stress. So first, let's look at hormones that are in growth. The growth hormone. This is a hormone that is released from the anterior lobe of the pituitary, and it targets the liver. The liver releases somatomedins, and these somatomedins are going to target they're going to target areas like skeletal muscle and cartilage, and so and the skeleton. So when it targets the skeletal muscles, it causes the skeletal muscles to increase production of those organelles, which we call myofibrils, and it makes the muscles get bigger. And then it also targets the cartilage in the growth plates of the skeleton, and it makes the cartilage grow faster, so then the bones are going to grow faster, like we saw in endochondral ossification. Those growth plates, which are cartilage, the growth plates grow longer, and eventually they get replaced by bone, so they become skeleton. but it helps for those bones to grow. So growth hormone basically makes muscles grow bigger and the bones grow bigger. Then we have the thyroid hormones. Thyroid hormones are necessary for growth because the nervous system needs the thyroid hormones that cause increased metabolism, and so does the skeleton. Skeleton also needs the thyroid hormones to increase metabolism of those cells so that they can proliferate and they can grow bigger and cause growth. Insulin is another hormone that's necessary for growth. Of course, insulin allows glucose into the cells. The cells can't create ATP. The cells can't grow bigger. The cells really can't do anything if they don't have nutrients like glucose and also lipids and amino acids. And insulin allows all three of those things into your cells. The other hormones like PTH and calcitriol, they have to do with calcium levels. So we need PTH to increase the calcium levels in your blood so that your bone can get to them. So we need both PTH and calcitriol to increase calcium in the blood, and then the calcium in the blood will be deposited into the bone so that your bones become nice and strong and dense. Then we finally have reproductive hormones, and so those reproductive hormones, I mean testosterone, estrogen, progesterone, and they are going to increase the skeletal growth in both males and females, and they also give those secondary sex characteristics to both males and females. So those are all the hormones that are involved in growth. And now finally, the last thing that we're going to talk about is your response to stress. So whenever you're under any kind of stress, and it doesn't matter if you are undergoing physical stress or emotional stress or just stress from an illness, your body's going to go through 3 different phases. There's an alarm phase, a resistance phase, and an exhaustion phase. So the alarm phase is the very first phase that occurs, and this is your immediate response. And the organ that's involved here is the adrenal medulla. So the adrenal medulla is the first gland that's going to get stimulated when you're in the alarm phase. So you get a stress, and the adrenal medulla kicks in, and it's usually directed by the sympathetic nervous system. So the sympathetic nervous system saying, "Ooh, I got an exam coming up," and boom, it sends out this message through the sympathetic nervous system. Your adrenal medulla gets stimulated, and it's going to release epinephrine. So epinephrine is the dominant hormone in this first phase. So when epinephrine is released, its main thing is that it's going to release all your energy reserves. So your energy reserves are glycogen. Glycogen stored in the skeletal muscles, it's stored in the liver, and epinephrine is going to release the glucose from that glycogen so that your cells have glucose. So the skeletal muscles have glucose so that they can run away if they need to, or they can fight if they need to. So the body is basically preparing for fight or flight. The liver lets out the glucose so that your brain can get to the glucose, and your brain will become more alert and ready to think and react as quickly as possible. Then if that stress from the alarm phase lasts a little bit longer than a few hours, then the body goes into what we call the resistance phase. Now in the resistance phase, the adrenal cortex is what's going to react. And the adrenal cortex releases a hormone called glucocorticoids. So glucocorticoids are the dominant hormone in the resistance phase. So in this phase, the adrenal cortex releases these glucocorticoids, and we know what glucocorticoids do. We know they're anti-inflammatory, and we also know that they put glucose out into the blood. They don't allow the cells to absorb the blood, and they force the glucose out into the blood. It does that because the nervous system has a high energy demand, so it has a high demand for glucose. You need glucose to make energy. So the nervous system really doesn't use much of anything else besides glucose, and it needs to have glucose ready as soon as it needs it. You know, if you're in a fight or flight situation, you need your brain to be ready all the time, because you need to be able to react consciously, cerebrally with your brain as soon as possible. The other thing is that lipids and amino acids will be mobilized for energy too. This is in case glucose runs out, then the body can use lipids and amino acids as necessary. So then, though, if the stress lasts weeks or even months, then the body starts to go into the exhaustion phase. So the exhaustion phase occurs again after weeks or even months. All the glucose is used up, all the lipids are depleted. There's nothing left. There's like no nutrients left at all. And so the main hormone here is aldosterone, because aldosterone is saying, look, if we can't keep nutrients in the body, then I had better at least try to keep our electrolytes in balance. And so aldosterone causes sodium to be reabsorbed at the kidney. But every time one sodium is reabsorbed back into your body in the kidney, one potassium is being released. It's like this is countertransport. Sodium gets reabsorbed, potassium gets released. So potassium then ends up going out into your urine, right? And we're losing a lot of potassium. And that's not good, because even though the body was trying to maintain electrolyte balance, maintain water balance at the very least by retaining this sodium, the electrolytes become imbalanced. So the body's able to retain sodium, but at the same time, it is getting rid of potassium. And when you get rid of too much potassium, that's not good. Your heart needs potassium. And without potassium, your heart could go into heart failure. If a person goes into this exhaustion phase, corrective actions must be taken immediately or they will die. All right then, this ends our second video on the endocrine system, and we will talk about this when we get together soon.